Ever wondered why you feel extremely thirsty even after drinking gallons of water? Or why you're constantly battling fatigue despite getting an adequate amount of sleep? Could it be that your body is trying to tell you something? Well, these could be more than just random occurrences. They might be subtle signs of prediabetes, a condition that often goes unnoticed. This might be due to prediabetes. Stay tuned to find out more. Prediabetes, as the name suggests, is a condition that often leads to type 2 diabetes. It's a health situation where blood sugar levels are higher than normal, but not yet high enough to be diagnosed as diabetes. This stage is like a red warning light flashing on your car's dashboard, signaling potential problems ahead if not addressed promptly. Prediabetes plays a pivotal role in the diabetes spectrum, serving as a precursor to full-blown diabetes. It's the gray area, the twilight zone of blood sugar levels, which if ignored, can lead to serious health complications. Early detection of prediabetes is crucial. It's like catching the villain while he's still planning the crime, giving you the chance to foil his plans. By recognizing prediabetes early, we can take steps to reverse it, thereby preventing the onset of type 2 diabetes. Recognizing the early signs of prediabetes can lead to timely prevention and treatment. One of the most common symptoms of prediabetes is excessive thirst. This isn't the kind of thirst you feel after a long workout or on a hot day. It's an insatiable thirst that persists even after you've had plenty to drink. You might find yourself reaching for water bottles more frequently, or feeling parched despite drinking your usual amount of fluids. This excessive thirst is a result of high blood sugar levels. Your kidneys work overtime to filter and absorb the excess glucose. When they can't keep up, the excess sugar is excreted into your urine, dragging fluids from your tissues along with it. This triggers a cycle of thirst and frequent urination, another common symptom of prediabetes. Speaking of frequent urination, this isn't the occasional need to go. It's a persistent urge that interrupts your day and night. You might find yourself waking up multiple times during the night to go to the bathroom, or needing to go far more often during the day than you used to. This isn't just inconvenient, it's your body's way of trying to get rid of the extra sugar in your blood. Lastly, let's talk about fatigue. We've all felt tired after a long day, but fatigue associated with prediabetes is different. It's an unexplained, persistent tiredness that doesn't get better with rest. This happens because your body's cells can't absorb sugar due to insulin resistance. Without sugar as a fuel source, your body lacks the energy it needs, leading to feelings of constant exhaustion. Remember, these symptoms, excessive thirst, frequent urination, and persistent fatigue, aren't always signs of prediabetes. They could be symptoms of other health conditions, or even just the result of a busy, stressful lifestyle. However, if you're experiencing these symptoms consistently, it's important to consult with a healthcare professional. While these symptoms might seem common, they could be indicators of a looming health issue. Don't brush them off as simply part of a busy life. Listen to your body. It might be trying to tell you something important about your health. Another symptom that might not strike as alarming is blurred vision. This might sound odd, but it's true. Prediabetes can affect your eyesight. This happens because elevated blood sugar levels can cause the lens in your eyes to swell, distorting your vision. You might find yourself squinting more often or having difficulty focusing on objects. It's easy to dismiss this as a sign of aging or just needing a new prescription for your glasses. But if you're also experiencing other symptoms we've discussed, it could be a sign of prediabetes. Now let's talk about the healing process. Have you noticed any cuts or bruises on your body that seem to take longer than usual to heal? This could be another warning sign. When your blood sugar levels are higher than normal, it can affect your blood circulation, making it harder for blood, and therefore, the necessary nutrients to reach your wounds. This slows down the healing process. And remember, it's not just about noticeable wounds. This also applies to internal injuries and post-surgical recovery. Lastly, we need to address frequent infections. This might seem like an odd symptom to link to prediabetes, but there's a significant connection. High blood sugar levels can weaken your immune system, making you more susceptible to infections. This could range from frequent colds and flu to more severe infections like skin or urinary tract infections. If you find yourself getting sick more often than usual, it's worth considering whether prediabetes could be the cause. It's important to remember that these symptoms might seem unrelated or trivial on their own. Blurred vision could be due to tiredness, slow healing might be due to age, and frequent infections might be due to a seasonal change. But when these signs come together, they paint a different picture. They might not be life-threatening on their own, but they can lead to significant health issues if left unchecked. These signs, though often overlooked, could be your body's way of warning you. It's crucial to listen to these signals, understand what they mean, and take proactive steps to maintain your health. Often prediabetes doesn't show any symptoms. It silently prepares the ground for diabetes. This is the chilling reality of this condition. It's a silent predator, lurking in the shadows, quietly laying the groundwork for a life-altering disease. Prediabetes can sometimes be asymptomatic. This means that while your body is fighting a hidden battle, you may not feel any different. It's like a thief in the night, stealthily stealing your health without you even realizing it. Why is it so sneaky, you ask? Well, prediabetes is a state where blood sugar levels are higher than normal, but not high enough to be classified as diabetes. And this gray area, this no man's land, can often go unnoticed. This is because our bodies are remarkably resilient, masking the small changes that occur in the early stages of this condition. So, what does this mean for you? It means that regular checkups are not just important, they are crucial. Regular blood tests can detect these small changes, catching prediabetes before it evolves into full-blown diabetes. The key here is to be informed. Know your body, understand the risk factors, and get regular checkups. This is not just about catching prediabetes early, it's about preventing diabetes altogether. It's about taking control of your health, about not allowing this silent predator to take hold. Being informed and proactive can help you stay one step ahead. So let's be vigilant, let's be proactive, and let's keep this silent predator at bay. Prevention is always better than cure, and it's no different with prediabetes. If we can catch this condition early, or better yet, prevent it entirely, we can avoid a lot of potential health complications down the line. In this pursuit, there are several key strategies to keep in mind. Firstly, regular exercise can be a game changer. You don't have to run a marathon or lift heavy weights to make a difference. Simply being active for 30 minutes a day, 5 days a week, can significantly reduce the risk of prediabetes. This could be a brisk walk, a bicycle ride, or even a dance class. The key is to find an activity you enjoy, so it becomes a part of your lifestyle, not a chore. Another crucial preventative measure is maintaining a healthy diet. This doesn't mean you have to give up all your favorite foods, but it does mean making conscious choices about what you eat. Incorporate more fruits, vegetables, whole grains, and lean proteins into your meals. These foods are not only delicious, but also packed full of the nutrients your body needs to function at its best. Reducing sugar intake is also a significant step towards preventing prediabetes. Try to limit processed foods and beverages high in sugar. Swap that soda for a glass of water, or that candy bar for a piece of fruit. It's small changes like these that can make a big difference to your health in the long run. Lastly, regular medical checkups are essential. Regular health screenings can help detect prediabetes early, making it easier to manage and prevent progression to type 2 diabetes. So don't neglect those yearly doctor's appointments. In conclusion, prevention of prediabetes is not about drastic changes, but rather about sustainable lifestyle modifications. It's about making choices that are good for your health, not just now, but for your future too. Adopting a healthy lifestyle can help prevent not just prediabetes, but a myriad of other health issues as well. To wrap up, it's crucial to recognize the early signs of prediabetes. These signs can be subtle, often mistaken for everyday fatigue or stress. They include increased thirst, frequent urination, and unexplained weight loss. More severe symptoms can involve blurred vision and a tingling sensation in your hands and feet. Now let's not forget about prevention. Leading a healthy lifestyle is key. This means regular exercise, maintaining a balanced diet, and keeping your weight in check. It's also worth mentioning that reducing your consumption of sugary drinks and processed foods can significantly lower your risk. And remember, regular checkups are vital. Even if you're not experiencing any symptoms, a simple blood sugar test can catch prediabetes early on. So keep an eye on these symptoms and work towards a healthier lifestyle. Remember, your health is in your hands. Stay informed, stay healthy.